this video, we'll talk about oral submucosal fibrosis. Now, here we will discuss about the pathogenesis. So, as we all know that OSMF is caused because of chewing of the areca nut or the betel quid. Now, what happens is there are different compounds present in betel quid that are responsible for the pathogenesis. So, the first one being the arachidine, all right, and the guaiacane. Then the tannins and catechins that are received from flavonoids, then copper, and then we will also discuss about the constant chewing that is done in OSMF. So first of all, this arachidine. Now what happens is this arachidine, it is hydrolyzed and it is converted into areca lane. Now this causes the cellular injury, due to which there is increase in the fibroblast activity. There is stimulation. This will lead to an increased synthesis of collagen. In lamina propria. So this will further lead to juxtaepithelial hyalinization, which will further lead to perivascular fibrosis. Now coming on to the catechins. Now tannins and catechins, they inhibit the collagenase enzyme. Now this leads to an increased production of collagen and decreased breakdown of collagen, leading to OSMF. So this is also going to lead, and this is also going to lead. Now copper. Now what we see is in copper, we see that there is a high amount of soluble copper which is present in the salts. Now due to this, what happens is there is increased lysyl oxidase activity. Now due to this increased lysyl oxidase activity, what we see is there is an increase in the insoluble collagen, which indirectly leads to the OSMF. Now in this, what we see is there is constant chewing. So due to that, the masticatory muscles, they undergo fatigue. Masticatory muscles, they undergo fatigue due to the overactivity and the contracture. Now due to this fatigue, what happens is basically why it is happening, because of the depletion of the glycogen, due to which it will lead to muscle fibrosis, leading to trismus, that is the inability to eat. So this perivascular fibrosis will also lead to reduced vascular tissue vascularity. This in turn will lead to the depletion of the glycogen and indirectly leading to trismus. So as we all know, what is oral submucosal fibrosis? It is basically a disease which occurs in the oral cavity. It can also extend to the pharynx. It is characterized by vesicle formation, juxtaepithelial hyalinization, fibrosis of the lamina propria, atrophic changes, which will further lead to fibrosis, and then which will ultimately lead to the trismus. So this is OSMF, and it is caused by betel quid. So this completes the pathogenesis of OSMF. Thanks for watching.